Hi, my name is Sarah Langard, and the Healthy People's 2020 topic I chose was sexually transmitted diseases. And the article I looked at is called Identifying Psychosocial and Social Correlates of Sexually Transmitted Diseases Among Black Female Teenagers. Black teenagers have relatively high rates of STDs, and this study focuses in on the role of contextual factors as well as risk behaviors. The study explores four categories of risk and protective factors on having a biologically confirmed STD. Approximately 25% of teenage girls aged 14 and 19 years old in the United States have 1 in 5 commonly sexually transmitted diseases, and rates of infection are higher among Black teenagers than among teenagers from other racial and ethnic groups overall in the southern United States. Gonorrhea and chlamydia rates decreased among all 15 and 19-year-old girls from 2011 to 2012, but in 2012, 15 and 19-year-old Black girls had a rate of chlamydia approximately 5 times higher and a rate of gonorrhea approximately 15 times higher than did her counter-white part. The study design chosen for this study was a cross-sectional survey conducted from April to September of 2017 with 350 Black female teenagers aged 14 and 19 years of age, recruited from a publicly funded teen clinic in Atlanta, Georgia. Inclusion criteria were as follows: self-identified Black/African Americans, born in the United States, 14 to 19 years old, had vaginal sex in the past 6 months, and sought services at the clinic on the day they were recruited for the study. The outcomes measured for this cross-sectional study included a urine sample to determine if they have an STD and to respond to a 30-minute written survey that addressed 4 categories: risk behaviors, perceptions of STDs, relationship with the most recent male partner, and social factors. The survey assessed individual risk behaviors, like initiated vaginal sex by age 15 years old, ever forced to have sex, like oral, vaginal, or anal, the number of sex partners in their lifetime, if they ever used drugs like marijuana or cocaine in the past month, and condom use in the past month. The perception of STDs was assessed by asking whether they worried about STDs in the past 6 months, perceived burden of having an STD in the next 6 months, like able to deal with it versus the worst thing, and agreed or strongly agreed she would feel dirty and or embarrassed if she had an STD in the next 6 months. The survey characterized a participant's relationship with her most recent male partner as length of sex relationship, whether she considered him a serious partner or boyfriend, frequency of sex, and whether she was still having sex with him. They also addressed whether she or her partner had concurrent sex partners in the last 6 months. The last aspect the survey assessed were social factors, like whether any household member received public assistance like food stamps or school lunch, if her mother completed high school or received a GED, if she lived with her father, and if she had a job in the last 6 months. First, they assessed by varied associations between each potential risk factor in having an STD. They began a multivariate analysis by constructing a logistic regression model for each of the 4 categories of potential risk factors. Each of the 4 models included factors within the particular category with a p-value less than 0.1 from bivariate analysis. Next, they entered variables with p-values less than 0.1 from the 4 category-specific models into a single multivariate model and retained those with a p-value level less than 0.05 to arrive at a final model. The participants who initiated sex earlier, who had more lifetime partners, and those who had a history of STDs were more likely to have an STD. 22.7% of those who believed an STD would be the worst thing that could happen to them had an STD. There were 2 STD perceptions that were statistically significant at p less than or equal to 0.05. Teenagers who believed that an STD would be the worst thing that could happen, and teenagers who would feel both dirty and or embarrassed having an STD were less likely to have an STD. Living with a father was associated with lower risks of STDs. Having a father in the household may be a proxy for more supportive parent-child relationships. Two parents may find it easier to offer supervision, communication, and/or support to help teenagers safely navigate sexual relationships. Clinicians should address relationship factors, past partners, STD stigma, and social support. Clinicians should help patients understand how past partners and sexual networks might place them at risk for an STD. Social support from both parents may be important to help teenagers navigate sexual relationships. Additional research is needed to identify and understand how a more complete set of individual, relationship, and social factors are associated with and influences STD risk among Black teenagers. Analysis may need to consider a more complete set of factors, including those that shape sexual networks and social support available for safer behaviors.